there yet. I'm recording. There we go. All right. Thank you for joining us today for Medicare 101. This is a great presentation for anyone who's just starting out in Medicare, family members who want to understand their loved one's benefits better, they're assisting, people who work with either people who are on disability and starting Medicare or turning 65 and starting Medicare, or if you already have Medicare and you just want to understand your benefit better, hopefully you'll find something that helps you in the presentation today. So we're going to be talking about some really important assistance programs. SHIP, which is the program I work for, it stands for State Health Insurance Assistance Program, and SMP, which stands for Senior Medicare Patrol. These are really, really your go-to programs for unbiased expert information and assistance about Medicare. We're going to go over Medicare Parts A, B, C, and D. I'm going to explain Medicare enrollment, what your Medicare options are. I've got some COVID updates and also some resources to help you familiarize yourself with where you can go directly for information about Medicare. So our New Mexico SHIP program, as I mentioned before, stands for State Health Insurance Assistance Program. We are a federal state partnership. I get ongoing training and support from the Centers for Medicare and Medicaid. Just last month, we had the SHIP National Conference where we worked with people from all 50 states and territories to make sure everybody is up to speed on what's happening with Medicare. We offer free, unbiased expert information and assistance, counseling, education, outreach for Medicare beneficiaries, but also their family members and caregivers, because often, once you start taking a more active role in your aging relatives' lives, you need to understand this stuff. Our sister program is the New Mexico SMP, or Senior Medicare Patrol. They are tasked with healthcare fraud prevention. So they educate Medicare beneficiaries on how to avoid, detect, and prevent healthcare fraud. As we all know, there is a ton of scammers and fraudsters out there, and they really target the Medicare population. And so this is the place to turn if you feel like maybe something iffy has happened. And then there are some specific, they're constantly educating people about specific scam and fraud attempts. The latest one is on, there's so much related to COVID, it's hard for me to even keep up. So the latest one is about the booster shots. And fraudsters are calling people saying that they can get a booster shot if they provide their Medicare ID information. So that is not going to happen legitimately. If anything, if you hear of anything like that, you definitely want to, number one, just hang up on the person. And number two, you can absolutely give us a call and report it. Because and many of the scams and frauds are identified first at this local level. So it's really important when you see something that seems wrong, that you know how to get the word out, how to let us know, and then we report it nationally, and then it gets investigated. And there really is a way to, respond and try to limit this kind of vulnerability. So it's a very, very important program. So diving in to Medicare. Medicare is health insurance for adults 65 or older and younger adults with certain disabilities and anyone with end-stage renal disease. I think we have this population, all the Medicare populations represented on this particular workshop, so that's great. So if you are 65 or older, you qualify for Medicare if you collect Social Security or Railroad retirement benefits, or you're a U.S. resident and either a U.S. citizen or a permanent resident having lived in the U.S. for 5 years in a row before applying for Medicare. You don't have to actually be collecting Social Security when you turn 65 in order to be able to get Medicare. And we'll talk about what you do if you're not actually collecting your Social Security check yet. So if you're under 65, the most typical way for people under 65 to go on Medicare is if they've been receiving Social Security disability for 2 years. And then once you've been collecting Social Security disability for 2 years, you get automatically shifted over from Medicaid to Medicare. And that can be a really challenging process sometimes. And so there is support and help for how to help that happen smoothly for you. And I'm glad you found your way to this workshop if that's your situation. End-stage renal disease, kidney failure also qualifies people for Medicare, and people who are on, for example, SSI, Social Security, well, I don't even remember what SSI stands for, SSI, but basically you've been disabled and don't have your own work history. You can also qualify based on a family member's work history. So just briefly, Medicare enrollment is automatic if you are already receiving a Social Security check. So if you've started collecting your Social Security retirement benefit, then you'll automatically be enrolled in both Part A, if you qualify for free Part A, and Part B when you turn 65. And you'll just get your Medicare card in the mail. If you are not collecting Social Security yet, then you won't be enrolled automatically. And you'll if you qualify for free Part A, that will still happen automatically, but the Part B, you'll need to enroll actively. I encourage people, especially now during the pandemic, to enroll online at the Social Security website, ssa.gov. It's quick and easy, and if you don't have a computer, well, everybody here has a computer probably, but if you're not comfortable with it, you're not sure how it works, you want support with that, you can call us and I will help you get enrolled. The initial enrollment period starts 3 months before the month you turn 65, continues through the month of your birthday, and for 3 months after you turn 65. So there's a 7-month initial enrollment period, and you can enroll in Parts A and B and in any additional coverage that you choose at any point during that 7-month period. Oops. If you missed that for some reason, the general enrollment period is every year from January 1st through March 31st. And if you enroll during the general enrollment period, your coverage will begin July 1st of that year. So you will have a gap. If you miss your initial enrollment period, you will have a gap. And there are penalties associated with that. I'm getting Zoom bombed by my boss. There are penalties associated with not getting enrolled during that initial enrollment period. You also qualify for a special enrollment period if you move, if your employer coverage ends, say you continue working when you're 65, and decide to continue with your employer insurance instead of enrolling in Medicare, once you do retire or end your employer coverage, then you have a special enrollment period in order to start your Medicare Part B and your other Medicare coverage. Does anybody have any questions before we move on about enrollment?
Yes.
Okay.
This is Carter. I have a
Hi, Carter.
question. Hi. I did just move from Texas to New Mexico. And I am 75 years old. And I've been on Medicare for some time. I don't understand what I need to do because I moved.
So that's going to depend partly, Carter, on what type of coverage you had. Okay, and so listen carefully as we go through so you can understand. And if you have if you had original Medicare, you probably will need to change your prescription drug plan because those are regional, right? And so when you move from one area to another, you may have to get a new drug plan that covers your new residence. If you have a Medicare Advantage plan, you're almost certain to need to change, right? So depending on—
I do not.
So it sounds like you have probably original Medicare with maybe a supplement.
I do.
Right. So you're probably going to need to change your prescription drug plan, but we can talk. You have got my number. You're going to give me a call later and I'll help you find a plan for your new area. The important thing to know about the special enrollment plan for moving is that it is only 2 months long. So if you have changed your address with Social Security, if you haven't, you need to do that. And if you have pretty much 2 months from that date to change your Medicare coverage. Does that sort of answer your basic question there, Carter?
Well, that's one answer, yes.
It's a start.
That's a start, yes.
All right.
Do I need to go down to the office to change it, or I changed it within the bank? The bank sends my check to the bank, you know.
Right. You are going to
So-
need to specifically change your address with Social Security. And, you know, off the top of my head, I know you can probably find how to do that on ssa.gov. But
Okay.
if you need more assistance than that, I'm happy to help you with it after the presentation.
Okay. All righty.
Okay.
Okay.
Now, okay. Any other questions?
Not right now, no. So I'll take it off.
If for some reason you decide to not accept Medicare, you're automatically enrolled in Medicare Part B and you decide not to accept it, the instructions are on the back of your Medicare card. Hopefully, you know, that is something that you want to consider very carefully before you do. And I would recommend that you talk to me first, because you don't want to expose yourself to penalties or a gap in your coverage. So definitely, before you do refuse Medicare, any part of Medicare, talk to somebody who can really guide you through that. So here's the basic Medicare, the two basic Medicare configurations. Medicare is like a series of building blocks. You can put it together in different ways to get different types of coverage. So one type of coverage is what we call original Medicare. It includes your Part A hospital coverage, Part B outpatient or doctor coverage, a Part D prescription drug plan, and then you may or may not choose to add a Medigap or Medicare supplement to that. And that configuration is what we call original Medicare. With original Medicare, Medicare pays 80%, you're responsible for 20%. It does not include any vision, dental, or hearing coverage. It just covers your hospital, your outpatient, your prescription drugs. People who prefer this type of coverage, generally, the benefits of it are that you can see any doctor that you want. Any doctor that accepts Medicare, you can go see. You don't have to get referrals. You don't have to worry about whether or not they're in network, because you're buying your insurance directly from Medicare. You can see any provider in the country who accepts Medicare. Now, people who really like to do their research and find the best place for treatment for whatever health conditions they're facing are going to be happier with this type of configuration, generally speaking. People who plan to travel a lot. I mean, right now, I don't think anybody's traveling, but it's not going to last forever, right? Because if you happen to be visiting friends or relatives or just exploring another part of the country and you needed medical care, there would not be an issue because you can see any doctor who accepts Medicare. So with this type of coverage, the Medicare pays 80%. The Medigap or supplement policy, if you choose to get one, is going to pay your 20% or whatever part of that your plan covers of the covered benefits. And so for this type of coverage, if you have a supplement, you're going to have low to no out-of-pocket costs when you get care. There is a higher monthly premium burden because you have the premium for Part B, you have the premium for your prescription drug plan, and you have the premium for the supplement. And those, generally speaking, are not cheap. Okay, so the higher monthly premium costs are kind of balanced by the low to no out-of-pocket costs when you get care. So some people who really don't want to have to worry about surprise medical bills prefer this type of coverage as well. The other way to put together your Medicare is to purchase a Medicare Advantage plan, otherwise known as Part C. A Part C plan includes your Part A hospital coverage, your Part B doctor coverage, and a Part D prescription drug plan. So all three of those building blocks are bundled together into one Part C Medicare Advantage plan that's offered by a third-party insurance company. So if you enroll in a Medicare Advantage plan, you're no longer purchasing your Medicare directly from Medicare. You're purchasing it from another company, but it is still your Medicare. Okay. If you join a Medicare Advantage plan, you can't also have a supplement. It's one or the other. You can't have both. The people who prefer the Medicare Advantage plans, often they're people who really want to have the vision, dental, and hearing coverage. There are additional benefits that can be offered with a Medicare Advantage plan that aren't offered through original Medicare. Another benefit that people seem to really like about the Advantage plans is the Silver Sneaker Gym membership. A lot of them also have an over-the-counter drug benefit where you can buy your supplements and vitamins. So there's a lot that people, a lot of additional benefits that people really like about the Medicare Advantage plans. The downside is you do have to get your health care within their network. And we're going to talk about the different types of Medicare Advantage plans and the differences in their networks, which is really important to consider before you join up. Also, it is really important to make sure you take a fine-tooth comb through the details of the Medicare Advantage plan before you join up, because a lot of times you're not necessarily getting what you think you're getting in terms of particularly the dental coverage. There are some really good plans that include really good dental coverage out there, but you have to look for them. And that is absolutely something that we in our office help people with. Medicare Advantage plans have a lower monthly premium burden. You have your Medicare Part B premium and then whatever the premium is for the Advantage plan. But the lower monthly premium is kind of the flip side of that is you are going to have copays for every service that you receive. So you are going to have higher out-of-pocket costs if you opt for a Medicare Advantage plan. And depending on your health situation, either one of these can be a really good choice. There's no, I tell people all the time, there is no right or wrong answer here. There, original Medicare or Advantage plan, neither one is better or worse than the other one, but there are better or worse fits for your wishes for your health care and your plans for retirement. And so really thinking, really understanding how the coverage works, thinking about what you're wanting in retirement and what you're wanting out of your health care, and then matching your priorities with the type of plan. That's what's going to lead to satisfaction in your Medicare for you. Before we move on to the next one and dive a little bit deeper into each part of Medicare, does anybody have a question now? Okay, either your heads have exploded because that was a lot of information, or it was just clear as a bell. I guess either one is possible, probably both. Okay, so Part A, hospital coverage. Everybody who has Medicare, whether you opt for original Medicare or an Advantage plan, this Part A coverage is going to be the same, okay? It covers your inpatient hospital stay. It covers your inpatient time in a skilled nursing facility. It covers the first 3 pints of blood. It covers home health care. That specifically means the skilled nursing care to be provided in your home. Occupational therapy, physical therapy. It does not, except under very specific circumstances, include personal care services, housekeeping, that sort of thing. And then hospice care is also covered under Part A. Most people don't have a premium for Part A. If you've worked for at least 40 quarters or 10 years and paid in to the system, then you're not going to have a premium. If you did not, if you don't have that work history for free Part A, I may be able to help you get it, because the premium for Part A is, I mean, it's just out of reach for most people. It's like, I cannot ever remember. You'd think I should look this up before I do the workshop, but it's something like $427 a month. It's over $400 a month. So sometimes people don't have the work history to get Part A for free. If you're in that situation, or you know somebody who is in that situation, please contact us, because we can help. We can screen you. There may be a way that we can help you get free Part A. We don't want people to be lacking that essential part of their health coverage, especially since there may be a way that we can help you get that through Medicaid. If you don't enroll when you're first eligible, you will accrue penalties, and you don't want the penalties. Part B is the doctor coverage. It covers your doctor visits, outpatient surgery and supplies, labs, X-rays, MRIs, CAT scans, EKGs. It covers the durable medical equipment, diabetic supplies. This is the test strips, needles, those sorts of things, not the medication. And preventive services. There's a whole host of preventive services that Medicare covers. And we're going to go over later in the presentation a really great checklist that you can use during your first 2 years on Medicare that'll help you make sure that you're really taking advantage of the preventive services that are available. So in 2021, the Part B premium is $148.50. If you're getting Social Security already, that will be automatically deducted from your check. If you're enrolled in Medicare but you're not collecting Social Security yet, you'll set up a payment plan. The Part B deductible is $203. The standard coinsurance for Part B services, if you have original Medicare, is 20%. If you have a Medigap or a supplement policy, it will cover all or part of that 20% once you've met the $203 deductible. If you have a Medicare Advantage plan, you'll pay a set copay for each service. Okay, so as I mentioned before, you want to be really careful before you opt out or delay enrollment in Medicare Part B. Because if you have a gap and you don't have what we call creditable coverage, you will accrue penalties. And the penalties for not enrolling when you're first eligible, you pay forever. It's not like you get penalized for a certain amount of time and then the penalty stops. You pay it forever. So really, you only want to opt out or delay enrollment if you're covered by your own or your spouse's active employer group health plan. Has to be an active plan, not a retiree plan, and the employer has to have more than 20 employees. So before you do that, you really want to consult with somebody from the SHIP program to make sure that you're not going to expose yourself to penalties. COBRA is not considered an active employer group health benefit, and retiree coverage is not considered either. And so if you think, oh, well, I'm on COBRA, I'll just keep doing that and I'll enroll in Medicare when it runs out, you will be paying penalties. And you may not be able to enroll immediately. You may find yourself stuck having to enroll during that general enrollment period. So just be very careful if you think that you're going to opt out of Medicare Part B, and make sure you consult with someone before making that decision. The late enrollment penalty is 10% for each 12-month period, and you pay that for the life of the coverage. So right now, the premium is $148.50. I round it to 150, 10% of that is $15. So if you have a 1-year penalty, you'll be paying $165 a month for your Part B premium instead of $150. And you pay that forever. When the premium goes up, you still continue to pay that extra $15. And if you have a longer gap, then pretty soon your Medicare gets to be quite expensive. So really, you want to avoid finding yourself in a penalty situation if at all possible. So for the special enrollment period, if you continued working past age 65 and stayed on your active employer group health benefits, or you stayed on your spouse's active employer group health benefits, you have 8 months after that ends to get enrolled in Medicare without accruing penalties and without having to wait for the general enrollment period. Okay, so you definitely do not want to opt out. You can see there, perhaps you're seeing that I'm really, really discouraging you from opting out of Part B. If you want to buy a Medigap or a Medicare supplement policy, you really need to get yourself enrolled right away. In order to enroll in a Medicare Advantage plan, you have to have both Part A and Part B. People who have TRICARE for life must be fully enrolled in Medicare Part A and B. I talked with someone who declined Medicare because they're like, oh, I don't need it, I have TRICARE. TRICARE considers Medicare to be the first payer. If Medicare doesn't pay, TRICARE won't either. So you definitely want to make sure that you know what your insurance plan requires once you're Medicare eligible, because you don't want to find yourself in the situation of thinking that you're covered, but your plan actually requires Medicare to be the first payer and won't pay unless Medicare has been billed. So I have actually worked with people in these situations, and it is very, very frustrating. So does anybody have any questions about the basic Medicare Part A and Part B before we move on? Those are the basic building blocks that no matter what other type of coverage you choose, you're going to have Medicare Part A and B. So if you opt for a Medicare Original, you're going to add a Part D prescription drug plan. This is outpatient prescription drug coverage. You purchase it through a private insurance company, and again, you can actually, I'm going to show you in a little bit how to find what plans are available in your area directly on Medicare.gov. You can also call us and we will help you with a plan search. There is a huge, insane amount of variation among the drug plans. I've seen premiums anywhere from $6 a month to over $100. And there's a lot of variation on what drugs are covered and how they're covered under each plan's formulary. So if you're taking medications, it very, very, very much pays off to make sure that you have looked in the plan finder, entered all the medications that you currently take so that you know how the plan you enroll in is going to cover your medications and what the estimated cost for the year is for you. You don't have to have both Part A and Part B in order to enroll in a prescription drug plan. You actually can have just one or the other. They are regional, like I mentioned earlier. So the plans are what plans are available is going to vary by area through the state and certainly from one state to another. And if you don't get signed up and have a gap in coverage, again, there will be penalties. So the maximum deductible allowed by Medicare is $415, but there is a huge amount of variation amongst plans. Some plans have a zero deductible, and then they go right through the spectrum all the way up to that $415. The monthly premiums also, as I mentioned before, vary wildly. The average base monthly premium that Medicare uses to calculate the penalty is $33.06. Okay, and the co-payments and co-insurances for when you pick up your medications, again, varies wildly from plan to plan. If you're looking for one of these, I highly recommend that you give us a call and we'll help you through a plan search. So the Part D late enrollment penalty is 1% of the national base premium multiplied by each month. Like the Part B penalty was by year, the Part D penalty is month to month. So if you have a 1 month gap, you're only going to be paying 33 cents extra. But if you have a 10-year gap, you know, you're going to have a much higher penalty. So again, there are programs where if you qualify, there's a benefit called Extra Help. It's a Social Security program that helps with prescription drug premiums and costs. And if you qualify for Extra Help, they will waive the penalties. So there may be a way to help you get prescription drug coverage if you've had a gap. So don't hesitate to give us a call and we'll see what we can do to round out your coverage. As I tell people all the time, sometimes I work with people who said, well, I didn't sign up for a drug plan because I wasn't taking any drugs when I turned 65. And I remind people that, you know, yes, we sign up for this coverage because of our current health issues, but we also have insurance, you know, mainly because of the unknowns. We have it in case something happens, and certainly during a pandemic is not the time to be underinsured. So if you or anyone you know doesn't have a prescription drug plan, needs help with this, please do give us a call. The last part of your original Medicare coverage, the last building block that you might want to add to that, is a Medigap or supplement policy. So these again are offered through third-party insurance companies, and what they cover is the 20% or some portion of the 20% that Medicare doesn't cover. They pay after Medicare. So if you have a health service and Medicare is paid 80%, you have a Medigap policy, it'll come in and pay you the other 20% so that you don't have any out-of-pocket costs for your care. If you get a service that's not covered by Medicare, your supplement policy will not cover it either. Okay, it is a second payer to Medicare only. Okay, so it's not going to cover anything that Medicare doesn't cover. It's not going to cover dental, vision, hearing. It only comes in to pay that extra 20% that Medicare doesn't cover. There's a bunch of different plans. I'm going to show you a chart in a sec, and they all cover things a little bit differently. So it's really important, if you're considering getting a Medigap policy, to look through the benefits, think about what's important to you, and then select the plan that's going to meet your needs. There are a variety of benefits. Some of them are really important, maybe really important to one person, but not important at all to another. So again, it's important to really look at it, understand what it means, and then make the decision based on what's going to best fit your priorities and your anticipated needs for your health care. And this is, you guys probably can't see this very well. That's okay. I'm going to show you where to find it on the Medicare.gov website. But basically, there is this chart, and it lists the plan identifiers, which are letters of the alphabet again, across the top. Those are the different policies that are available. And there's 1, 2, 3, 4, 5, 6, 10 of them. And then down the side, it lists the benefits. And if you look at this and you're like, oh, I can figure this out, and then you're like, what? I don't know what that means. You know what to do. All you got to do is call me. I already put my phone number in the chat, and I will help you through this. And there is explanation on the Medicare.gov website as well. Okay, before we move on to Medicare Advantage plans, does anybody have any questions about what these building blocks that we've discussed, part A, B, D, and the Medigaps? Okay, because really the answer that I'm going to give you, you know what it is. Call me. Okay, so Part C, or Medicare Advantage plans, also known as MAPs, MAPs, they are your Medicare coverage. A lot of times I'll talk to people and they'll tell me, oh, I have a supplement. And I'll be like, okay, really? And it turns out, no, what they have is a Medicare Advantage plan. So it's not a separate or additional coverage. It is your Medicare coverage. It's run by the private insurance companies that contract with Medicare. They have to cover what Medicare Part A and B cover. Those are the requirements. But they can offer additional benefits. Okay. Some of the Medicare Advantage plans do not include a Part D prescription drug plan. There are some retiree organizations that will offer a prescription drug plan to their retirees. Some people get their drugs through the VA or another Indian Health Services, something like that, right? And so they don't need a Part D prescription drug plan. But for the most part, you really want to make sure that your Advantage plan, if you enroll in one, includes a Part D prescription drug plan. Okay, And we've already discussed that you have to have both Part A and B in order to enroll in an Advantage plan, and you have to live in the plan's service area. There are some plans now that cater to people who do have end-stage renal disease. I need to update that slide. So just like with the prescription drug plans, there's a huge amount of variation plan to plan in deductibles, in premiums, and in how they, in copays, and in how they cover different benefits. So, it really makes a lot of sense if you're looking at this kind of plan to make an appointment with myself or one of my colleagues and really have somebody walk you through. There is a ridiculous amount of advertising for the Medicare Advantage plans. If you're just turning 65, you probably are inundated with mail, and it's like, how do you know what to pick? It sounds too good to be true. Is it? The thing to do, I always tell people, take all of that and put it in a box and then call us, and then we'll talk you through the details of the plans that are available in your area. And then after that, after you really understand what you're looking at, if you want to go back and dig through the glossies, then, then do that when you can look at it, understanding, what the benefits are. So fall open enrollment is coming up on October 15th. It runs every year from October 15th to December 7th. Once you're past your initial enrollment period or your special enrollment period, if you have one of those, for most people, open enrollment is the one time of year that they can make changes to their Medicare. So, but it is super important to understand that you can change every year. You have the opportunity to change your coverage. And there's a lot of reasons why it makes sense to at least look and see what's available. Oftentimes, your plan may change. You'll get a notice of coverage, an NOC, every year in September usually, that explains any changes to your plan. There may be changes in premiums, there may be changes in what's covered under the formulary. Sometimes a plan even withdraws from an area and is no longer available. So you got to pay attention to those notices that come around every fall. Sometimes your health conditions or the medications you take may have changed, and the plan that's been working for you just fine doesn't cover you very well anymore. So when that rolls around, fall open enrollment is the time to take a look at what options are available and make any changes. Our office, the State Health Insurance Assistance Program, from October 15th to December 7th, that is all I do, is help people with plan comparisons and help them find a plan that's going to better fit their needs. So that we do offer that assistance every year, and I encourage you to really take advantage of it. We're not selling anything, right? So if you work with an agent or a broker, they have skin in the game, so to speak, right? They have commissions to make and quotas to meet. We don't. We are here entirely to help you find the plan that's going to best suit your needs. So if you enroll in a Medicare Advantage plan, these are the types of plans that are generally available. HMOs or health maintenance organizations. These tend to have a very tight network of providers and be very local. And you have to get your care in an Advantage plan within the plan's network. So HMOs tend to be very, very, very tight. For example, if you live in Santa Fe, you probably can't even go see a doctor in Albuquerque, right? It's not going to be in your plan's network. PPOs, preferred provider organizations, tend to have a broader network. seeing a provider in Albuquerque probably wouldn't be an issue if you had a PPO. Sometimes they even extend out of state. So they can be you can have a much wider choice of in-network providers in a PPO than in an HMO, generally speaking. Another type of plan is private fee-for-service. There are just a very few of these available in New Mexico, and the same goes for the MSAs, or medical savings account. Those just started showing up maybe a year or two ago. I don't know how broad, and they're not particularly broadly available. And then the last type of plan here is the SNP. We call them SNPs. The SNP, or special needs plans. And these plans are for people who have both Medicaid and Medicare. So if you have a Medicare savings program, one of the Medicaid benefits that pays the Medicare premium on your behalf, you may qualify for a special needs plan. They are not available in every area. So that's one of the things about the Medicare Advantage plans is that they are very regional. There are some areas of the state where you can't even find one. There are some areas, like in Taos, I think there's only 3 available that you can sign up for. If you're someplace like Santa Fe, Albuquerque, Las Cruces, that has a much more dense population, you're going to have a lot of options. So that's and in some areas of the state, particularly along the Texas border, Medicare Advantage plans aren't widely available. And if you get your health care across the state lines in Texas, then this probably isn't going to be a good choice for you. So there's a lot to think about before you enroll in a plan, and we can absolutely help you make sure you've really considered all the most important points. Another really helpful resource, when you enroll in Medicare, you probably get one of these in the mail, but in case you didn't, the Medicare and You handbook is available online at www.medicare.gov. And you can go onto the medicare.gov website and you can actually download the handbook and have it just available whenever you want on your computer. This is really helpful. It'll help you. It has explanations for all of the benefits and all of the jargon that goes along with Medicare, and also sort of general information about what services are covered. So I highly recommend that you take a look at it if you haven't seen it already. They've also just recently launched a really great Get Started with Medicare feature. And again, it's on medicare.gov. I always recommend that people type into the address window on the computer, not the search bar, but the actual address. Type in www.medicare.gov, because there are a ton of websites out there that try to copycat Medicare. If you accidentally get onto a website that asks for any personal information before they'll let you into the website, or before they'll give you any information, just X out of it right away. That is not Medicare, and you don't want to ever give any personal information over the computer like that. It is almost certainly, well, it's not going to lead to anything good. If you wonder what to do, go directly to www.medicare.gov or give us a call. So once you go to this Get Started with Medicare, there is a great checklist, right, to help you. I know people often feel so stressed when they start Medicare. Have I done everything that I'm supposed to do? Am I missing anything? That checklist will really help you make sure you actually have done what you needed to do. And you've already hit several items on the checklist just by being in this workshop today. You can get a refresher tutorial on the basics. You can put in a little bit of information about your situation, not personal identifying information, but, you know, I just moved, that kind of information, and get some specifics about what you should do. You can explore plans and see what plans are available in your area. And there's a great little document that helps you really sketch out what services and what preventive services in particular you might want to take advantage of during your first couple of years that you're on Medicare, to make sure that you're really making the most of it. So I love this little feature that they just added a couple of months ago. I always try to direct people towards it. People are often so stressed when they start Medicare because it feels like such a big change, and it feels like, you know, whatever choices you make now, you know, are going to have such a big impact on your life, and they will. Particularly the decision about whether you want to enroll in original Medicare with a supplement or a Medicare Advantage plan. That's really the most important decision to make when you first start. But it's also really, really important to know that you're not, whatever you choose, you are not stuck with forever. You have that option during open enrollment every year to make changes. And, you know, there is support available to talk you through your decisions, just to make sure that you are going to have the satisfaction and the type of coverage that best meets your needs once you sign up for Medicare. Okay, on those basics, before we talk about how Medicaid works with Medicare, does anybody have any questions? No? So again, either your heads have all exploded and you're in a little puddle in your chair looking at your computer, or we're just doing really good, or both. Okay. So there is a really important benefit that Medicaid offers. Medicaid is state, Medicare is federal, okay? So the state Medicaid program offers a Medicare savings program. So confusing. That helps make Medicare more affordable to people on a fixed income, okay? So if you've enrolled in Medicare, but the premium is too high, you don't know, it just doesn't fit your budget, there is a benefit that helps pay those premiums to make Medicare more affordable. Because it's a Medicaid program, there are income eligibility requirements. There are no asset requirements. To qualify for this program, Medicaid just looks at your income. It doesn't look at what you own. It doesn't look at how much you have in the bank. It doesn't look at investments, nothing like that. Only income, which has really, that's a change that happened in 2021, and it's really opened up the program to a lot of people who either didn't qualify in the past or wouldn't qualify if assets were considered. So it's a very important program to help make Medicare more affordable for people, and also for those people who did not get enrolled for whatever reason when they were first eligible for Medicare. If they qualify for one of these Medicare savings programs, they can get Medicare immediately without having to wait for the general enrollment period, and without penalties. So that happens most often. The people that I've worked with who needed help getting their Medicare coverage through the Medicare savings program are veterans. Often veterans will decline Part B because they get their health care through the VA and they think they don't need it, and they discover later that they do. People who get their health coverage through Indian Health Services, and people who've had disabilities, people who are disabled. Those are most often those are the people that I'm able to help get their Medicare through the Medicare savings program. So again, if you're in that situation or anyone you know is in that situation, please have them call because we can help. You can apply yourself online at www.yes.state.nm.us. You can call the ADRC, that's the Aging and Disability Resource Center, at 800-432-2080, and they'll refer you to a SHIP counselor. You can also call me because I already gave you my number. And I am super quick at this. I can get it done for you in about 10 minutes. So for people who either don't have a computer or just aren't comfortable doing these sorts of things, we offer that assistance as well. The other main benefits that Medicaid offers to Medicare beneficiaries are the home and community-based waiver, and that is a full Medicaid benefit for people who need in-home caregiving services. So as I mentioned before, when we were talking about Medicare Part A and the home care services that it covers, it really only covers the skilled nursing. Often as people age or their health conditions, they get serious health conditions, they may need just a little assistance in the house in order to remain safely in their own home rather than having to go into a nursing facility. In that case, the home and community-based waiver is the benefit to apply for. You apply for it through the ADRC. You cannot apply for this benefit directly from Medicaid. It has to go through the Aging and Disability Resource Center, and that's that 800-432-2080 number. Because for this particular benefit, there are both medical and financial eligibility requirements. And so the assessment starts in the ADRC to determine the level of care. And then it goes to medical assistance division, and then it goes to income support division, and then it goes to it's a complicated process to get this benefit, but it is a very important one that can help people who need in-home caregiving services remain in their home so that they can age in place rather than go into a nursing facility. If you're already, or if someone is already in a nursing facility, then the Medicaid program is the institutional care waiver. It does not have the complicated eligibility process because you're already at nursing facility level of care, obviously, since you're in a nursing facility. So this benefit you can apply for through the Income Support Division. You can apply for it directly on Yes New Mexico, and it helps with the costs of a skilled nursing facility for people who need that. Okay. Any questions about the Medicaid benefits before we talk about the ADRC in a little bit more detail? Okie dokes. And you know what to do. If you have questions, you just give me a call. And my number again, my direct work cell phone number where you will reach me directly is 505-470-4443. I already put it in the chat and it will also be coming up on a slide in a minute. Okay, so the ADRC, or the Aging and Disability Resource Center, is the statewide call center for the New Mexico Aging and Long-Term Services Department. You can reach all of the Aging and Long-Term Services Department programs through the ADRC. Plus, they will connect you with statewide resources. It's an amazing service. When you call the ADRC at that 800-432-2080 number, you'll be speaking with an options counselor. The options counselors have just an incredible breadth of knowledge about programs and resources throughout the state. They can assist you with home and community-based waiver registration. They have access to what we call the Network of Care, which is a database that we maintain of resources statewide, and it can be literally anything under the sun. I started working for the Aging and Long-Term Services Department in the ADRC as an options counselor, and I fielded calls on everything from someone who needed to get their computer fixed, and I thought to myself, really? And then I asked my supervisor, and she's like, yeah, the New Mexico TAP program, the Technology Assistance Program. So for people with disabilities, there is a program to help you have the adaptive equipment you need and the technology. And this lady was able to get her computer fixed. I helped somebody find a program to certify her dog as a service animal. And that's just some of the fun ones, in addition to the general questions about senior center services, transportation, all of the questions about Medicare, Medicaid. Really, as we age, we're just bound to be faced with questions about things that we've never experienced before, right? It's uncharted new territory, and things are changing. And sometimes you don't know where to go. Well, now you know. Now you do. Call the ADRC. Whatever question it is that you have, whatever issue you're facing, they will be able to help you with information and potentially resources for that. We also offer short-term assistance, where they can the options counselors can make a referral to somebody like me who will follow through with you on whatever issue it is that you're having. I recently it probably took us 2.5 or 3 months to work all the way through the situation. A woman that I worked with had a Medicare Advantage plan. She needed a specific oral surgery procedure as part of, she'd had cancer in her jaw as part of the rebuilding of her mouth and jaw, and her Medicare Advantage plan wouldn't cover it. And it was such a specific procedure that the people who could do it were extremely limited, and they just denied her over and over again. And she needed this procedure in order to get her life back, right? And so, it took us a while. We had to get legal resources involved. I had to get Medicare involved at the national level, and we got her procedure, but it took a while. So that kind of short-term assistance is available. Also, the general SHIP, State Health Insurance Assistance Program information and assistance is available. The Senior Medicare Patrol. There's a prescription drug assistance program. Often people find that even with their insurance, the copay for a medication may just put it out of reach or may just destroy their monthly budget. We really don't want anyone rationing their medication or not taking it as prescribed because they can't afford the copay. And so please do call the ADRC at 800-432-2080, and they will make a referral to the Prescription Drug Assistance Program. And what will happen then is the person in that program will help connect you with pharmaceutical companies, patient assistance programs, and hopefully we'll be able to help you get your prescription at low or no cost. So the ADRC really should be the first stop for any questions you have. Often people will make 10 phone calls and never get the answer they need. And then when they finally find the ADRC, they get the help navigating the system that they need, or they get the answers that they need right away. So don't make those 10 calls first. Just call the ADRC. All right. There are some specific ways that Medicare covers COVID-related costs and services. So most of the testing, Medicare does cover COVID tests. Covers the antibody treatments if you do get COVID. I'm going to go fast through this. It covers telehealth visits, right? If you enroll in a Medicare Advantage plan and your plan is giving you trouble about covering the telehealth visits, which has happened occasionally, give us a call. We'll help with that. It covers the vaccine. Once boosters are available, Medicare will cover the booster shot for immunocompromised beneficiaries. So they cover the original 2 shots. If you haven't gotten yours yet, I highly recommend you look into that. If you are interested in a booster, right now, the only boosters that are being scheduled in the state of New Mexico are for immunocompromised people with a doctor's recommendation. And when they become more generally available, you can, I'm sure it'll be in the news, but if you have questions about who's eligible for a booster shot, you can absolutely call the ADRC. They'll be able to give you some guidance on that. The ADRC can also help you schedule an appointment. I think it's really important for people to know where to go if they can't find their vaccination card. The website is www.vaxviewNM.org, and you can just print out a copy of your immunization record, assuming that you went through the Department of Health's registration system. If you didn't go through that, you'll need to call the Department of Health. You'll need to make sure you get your vaccination record entered into the Department of Health system, and then you can get your immunization record that way. This is a super important thing that, that is available to Medicare beneficiaries during the public health crisis. Usually, in order to get 3 months supply of your medications, you have to be enrolled in a mail order prescription drug plan. But during the pandemic, you can get 3 months at a time of your medication from your local pharmacy. You have to know about the benefit in order to ask for it, but it should be covered. You should be able to get a 90-day supply from your pharmacy, regardless of what kind of drug coverage you have. Okay, any questions? I've given you a lot of information. If you are anything like me, and I know at least a couple of you are because we're all former teachers, the more I learn, the more questions I have. So I did not give you my contact information so you could not call me. If you have questions as you're processing all of the information that you've gotten today, or you think more about your situation, please do give me a call. I'm really happy to help. This is in the past. I need to take this slide out. This was last week that we did a booster budget 3-day enrollment event. Basically, if you are having issues with any costs, anyone on a fixed income who's having issues paying for their medical insurance, you have housing, utility, transportation, you're feeling the pinch in any of those areas, give us a call. We can help. I also want to make sure you know that there's live web chat available on our website, www.nmaging.state.nm.us. Sometimes, I will be real with you, sometimes when you call the 800 number, you may have a substantial hold time. We are understaffed at the moment. And so sometimes those hold times can get a little bit long. The alternative, if you lose patience with that, is to just go on our website. There's a live web chat agent available from 8 to 5. You can chat in your question. She will either answer it or she will make a referral and then I will call you. So for people who, it's particularly good, it's good for people who lose patience with waiting on hold, who don't like having to deal with the, push button menu to get to a real person, or who have hearing issues, right? This is a great way to get the information from a live person. Her name is Roseanne. She's sitting outside my office. Okay. And here's my contact information again, Chris Winterode, chris.winterode@state.nm.us. And my number again is 505-470-4443. I'll leave that up for a second. And then last but not least, not next to last, but not next to least, I highly recommend you follow us on Facebook. If you are on Facebook, I know a lot of people are dropping off of Facebook, but if you are on Facebook, follow the New Mexico Aging and Long-Term Services Department. You will get that we update. It's the first place we put new information. So you'll see the latest information about Medicare scams. You'll see the information about any workshops or events we have coming up, and also just general information from all of the departments, all of the different agencies within the Aging and Long-Term Services Department. It's a pretty active and informative group to follow. And if you feel so moved, please complete a survey about the workshop today. It's at SurveyMonkey. So it's www.surveymonkey.com/r/ACLED. And I do love to get feedback. So if you have a few moments, it's very brief. I appreciate it if you take the time to do that. Okay. Does anybody have any questions, comments, complaints? Well, please do. If you have follow-up questions or you want to get more specific, detailed information about your particular situation, you want to get assistance with plans, you want to really make sure you want to run what you're thinking past somebody who can, provide you with feedback or reassurance about that, please do give me a call. I'll be happy to talk to you about it.
Chris?
Yes, ma'am.
Did you give your hours for your?
So I work for the state. I work from 8 to 5.
Okay.
8 to 5 Monday through Friday.
Okay.